Welcome everyone, and I'm here to present the progress of my PhD, which is titled as Neurocognitive Development of Children with Perinatal Insults. I'm Dóra, Bodócs, a cognitive psychologist and a first-year PhD student, and together with my team, we are working together to achieve our vision, which is to give every child a chance to speak on time. And our current mission within this vision is to reveal the early indicators of language difficulties and its connection to perinatal insults. I have two ongoing projects. Both of them will focus on the prognostic accuracy of different biomarkers in order to predict the neurocognitive and the language delay in children with neonatal encephalopathy. The first project will be a systematic review and a meta-analysis, and the second project will be a single-center retrospective cohort study. So let's move to my first project. Here we will investigate the prognostic accuracy of different biomarkers for detection of neurocognitive deficits in children with neonatal encephalopathy. So asphyxiated encephalopathy, which affects 0.5 to 3 per 1,000 live births in high-income countries, jeopardizes the neurocognitive development in these children. The late diagnosis of neurocognitive deficits and language delay can worsen learning difficulties and can lead to poor social growth. Currently, we can't predict the cognitive and the language outcomes of these children at the age when they will attend school. However, this is the major concern of their parents. The early accurate prediction and the intervention based on this prediction, which will focus on the developmental delay, will result in better developmental trajectory and better adult performance. Based on these pillars, our aim is to find the most accurate predictors for predicting delayed neurocognitive deficits. Our clinical question is that what's the most accurate early prognostic tool for predicting delayed language development in children with neonatal encephalopathy? The population will be children with neonatal encephalopathy. The prognostic factors that we would like to include are the MRI, amplitude-integrated EEG, MRS, NIRS, and the blood gas markers. The outcome will be the prediction accuracy of language development. Our hypothesis is that the MRI and the amplitude-integrated EEG are the most accurate markers in the prediction of delayed language development in children with neonatal encephalopathy. We hope that our results would result in an early accurate prediction and early intervention based on these predictions. Here you can see the search key. The first domain refers to the age group that we would like to investigate. The second domain refers to the condition. The third domain refers to the neurocognitive outcomes. And the fourth domain refers to the biomarkers that we would like to include. We conducted our search in 3 databases, and you can see the results here. We ended up with more than 7,000 articles, and after the title abstract and the full text selection, we ended up with 25 eligible full text, and in the citation chaser part, we ended up with more than 8,000 articles and have 27 eligible full texts. Currently, we are at the data extraction phase of this project, and we wish to finish it soon. So let's move to my second project, which will be a single-center retrospective cohort study, when we will investigate the prognostic accuracy of different biomarkers for detection of developmental language delay in children with neonatal encephalopathy. This study is the SANE study, which stands for Speech of Kids After Neonatal Encephalopathy, and this will be a single-center retrospective cohort study. So despite the fact that we can acquire our native language pretty effortlessly and easily, at the age of 5, 7 to 8% of the children are diagnosed with a developmental language disorder. Some studies have demonstrated impaired speech and language skills in children with neonatal encephalopathy, even though they had a good general neurological outcome. Currently, there is no detailed exploration of the domain-specific cognitive outcomes in these children, which means that the currently available biomarkers can predict whether the given child will have a good or a bad general neurological outcomes. However, they can't say anything about the domain-specific skills of these children. Based on these, our current aim is to find the most accurate predictors of language deficits in children with neonatal encephalopathy. Our clinical question is that what's the most accurate prognostic tool for predicting delayed language development in children with neonatal encephalopathy? The population is children with neonatal encephalopathy. The prognostic factors are the MRI on a special highlight on the diffusion abnormality of the corpus callosum, the amplitude integrated EEG, and the blood gas markers. The outcomes is the prediction of language deficits. Our hypothesis is that the corpus callosum MRI quantified diffusion abnormality provides the most accurate prediction of delayed language development. And as in my first project, we hope that our result would lead us to early prediction of delayed language development, which would result in an early intervention. So we submitted the ethics approval, which was accepted, and we included those babies who were born on the gestation week at 35 weeks or more, and had perinatal asphyxia and received therapeutic hypothermia. We excluded those children who have hearing loss or raised in a multilingual language environment, and we also excluded those children who were born with congenital abnormalities or suffer from a metabolic disorder. Here you can see that these children were treated at our clinic as a newborn, and we have all the available blood gas values about that time, and we also have the amplitude integrated EEG data about these children and the MRI scans which were taken at the age of 4 days. The third examination phase was neurocognitive follow-up checkup where they were examined the cognitive and the language skills of these children at the age of 2, and currently we are at the 4th phase, so we are measure their cognitive and the language skills at the age of 4 to 7 years. At this stage, we have a free in-person examination of these children, as well as online parental questionnaire on the Evasys system. Here you can see the tests and the questionnaires that we are using. The COBAC and the VEPSI tests are our main neurodevelopmental tests, and we also have several parental questionnaires which focus on those factors which can influence the language outcomes of these children. So here you can see that we are targeting a patient number of 93 children. We already finished the data collection with 6 children, and the data collection started with 21 children, and with 66 children, the data collection is not started, but it's an ongoing progress. Here you can see some baseline parameters about our population, and we are planning to finish our data collection at the beginning of 2026. So in a summary, we would like to finish my first project at the winter of this year, and my second project at the winter of next year. And I would like to finish my presentation with a quote of Murakami Haruki, that it's all a question of imagination. Our responsibility begins with the power to imagine. And thank you for your kind attention.
What is your opinion, your research? Is it going to have any effect on the clinical work of the pediatricians, if you find here something?
Yes, because if we can say that the early biomarkers, so if the given child will have an X biomarker measurement, and we can say that that measurement means that the given child will probably have language difficulties, the staff of the clinics can suggest some early intervention plan for the parents. So yeah, I think.
I wanted to ask, what is the specific reason that you decided to take the COBAC test in 2 sessions?
Mm-hmm. Yeah, so we are using 11 subtests of these tests, which takes around 1.5 or 2 hours to take with the children, which is a really long time. So we decided to have it in 2 sessions in order to maintain the attention span of the children on a good level. So yeah, they can cooperate with us.
Thank you.
I would like to ask regarding your second project, if you could explain a bit about your experience with the language skill you could shed some light about that, would be great.
So we finished the data collection with 6 children, and currently we are seeing that 4 out of these 6 children have some difficulties, but like delay in their language outcomes. So yeah, I think that I can say that it's like appealing results at this point. So yeah.
You have mentioned in your second project on a slide, maybe it was a study design or something, parental questionnaires or online questionnaires or something. Can you give us more details about that?
Yes, I will go back. So here you can see several parental questionnaires. We asked the researchers at our clinic that what factors should we take into consideration to measure. And here you can see that we are, for example, screening for ADHD or autism spectrum disorder, which is measured by the social communication questionnaires. But the strengths and difficulty questionnaire is also really important and widely used questionnaire in this group of children. And here you can also see the socioeconomic status questionnaire, which was proven to have the parental socioeconomic status is proved to be a really important factor in the development of children with neonatal encephalopathy. And the Jaworski questionnaire is a really interesting questionnaire because they measured that the parental concerns about these children, not these children, but they measured it, they measured the parental concerns, and we think that it's a really important like factors to take into consideration. And you can also see that the digital children questionnaire is a questionnaire to measure like the screen time of the children, which we think that it's also an important factor to use. And we have several questions on the previous development of the children, like what kind of intervention and developmental programs that children attended previously. So yes, in details.
Thanks, thank you.
Thank you.
In your second topic, based on your hypothesis, or your team's hypothesis, the MRI diffusion abnormality can predict maybe the later outcomes. Is it a yes-no question? I mean, having abnormality or not, or is it rather a scale? So you want to investigate the severity of this diffusion abnormality? The second one. So the extent of the abnormality. Okay, and what about the timing? Have you already discussed that? I mean, having an MRI from the first week or in the first months might
yes, so
affect maybe the picture.
On this figure, you can see that the MRI were taken at the age of 4 days. So yeah, it's the 4 days. So at the first days.
So yeah, so it is a quite early MRI.
Yes.
All right, okay. And based on your experience so far, so you want to basically go back your patients in the age of 4 until 7. So do you expect any loss to follow-up? Probably it will happen. I'm just curious, about the ratio.
Yes, but we are at the, so these children needed to come back to the clinic at the age of 2, which were a selection for those parents who won't be cooperating with us. So we hope that at this 4th phase of this examination, we will mostly have to contact parents who will cooperate with us. So, but we are of course expecting lost in follow-up as well.